Human papillomavirus, or HPV, causes cervical cancer. So for the last 7 years, all schoolgirls aged 12 and 13 have been offered the vaccine that can help prevent HPV infection. Uptake of the immunisation has been good. More than 85% of girls got the jab last year. Anyone who comes into sexual contact with someone who has had the vaccine would be protected as well. But boys and men can still catch the virus from a woman who hasn't been vaccinated as a teenager or from another man. That means every year in the UK there are more than 2,000 cases of cancer in men caused by the HPV virus, while the cost of extending the immunisation programme to include boys would be around £20 million a year.
Well, it's always cheaper and much more cost effective if you prevent a disease rather than treating it, not just for society and financially, but for the individual who has to suffer through treatment and the misery of a serious illness caused by HPV.
The body responsible for public health in England believes there'd be little additional benefit to immunising boys. But this doctor, who offers the jab privately and intends vaccinating all his sons, says every child deserves the same protection.
There's only one chance to do it. You have to get the best from this vaccine by using it before these kids become sexually active. The clock is ticking for each cohort of children.
It's estimated immunising girls will prevent 400 women from dying of cervical cancer annually. The committee which advises the UK's governments on vaccines must now decide if the potential to save more lives by immunising boys is worth the cost.
So, Kathy, what kind of timescale could we be looking at here?
Well, it'll be mid-November before we will know what vaccines advisors have told the government, and then it's up to each UK nation to decide individually what they want to do with that recommendation. Interestingly, Public Health England, for example, also looking at a different approach, which is whether it would be worthwhile to specifically target young gay men, because they are certainly one group at the moment who don't benefit in any way from the immunisation of young girls.
OK, Kathy, thanks so much for that.